Scientific Facts About Drug Abuse to Teens webinar. So let's get started. If you're viewing as a group, please go to the chat window and type in the name of the person registered and the total number of additional people in the room. For example, Tammy Jones +3. This will help us with our final attendance count. This presentation may be downloaded now. You can please visit our website at www.sbhforall.org/webinars to download the presentation. All attendees are in listen-only mode. So we want to hear your questions. So if you have a question during the session, you can use the chat tool that appears on the bottom right of your control panel. Attendees will receive an evaluation survey after the webinar. Please let us know how we're doing and the new topics you would like us to cover. This webinar is being recorded and will be archived on our website. You may access the archived webinar and a PowerPoint slides under the Special Initiatives category, typically within 3 business days, by visiting our website, sbhforall.org/webinars. So in today's webinar, we expect that by the end of this webinar, you'll be able to identify integral facts about the effects of drug abuse on the brain, body, and behavior to provide to youth and youth influencers, discuss science-based substance abuse and addiction resources and materials, and learn how to hold educational events for National Drug Facts Week 2015. So now let's take a poll. So now we're asking who's in the audience. We'll give you a minute to respond. So about 5 more seconds. Okay, great. We see about 56% of our attendees are from school or school-based organizations. All right, here's our second poll. Have you heard of National Drug Facts Week before? All right, about 5 more seconds. All right. I see that about 63% have not heard about National Drug Facts Week, so I'm looking forward for this discussion. All right, the panelists presenting today will be Brian Marquis, who is a Public Liaison Officer within the Office of Science, Policy, and Communications for the National Institute on Drug Abuse, or NIDA, which is part of the National Institutes of Health based in Rockville, Maryland. NIDA's mission is to lead the nation in bringing the power of science to bear on the drug abuse and addiction. At NIDA, Brian is charged with building and sustaining partnerships with federal, state, local governmental organizations and the dissemination of NIDA science-based materials and publications. Brian developed and implemented NIDA's National Drug Facts Week initiative 5 years ago. National Drug Facts Week is a science-based education campaign to provide youth and youth influencers with integral facts about the effects of drug abuse on the brain, body, and behavior. And without further delay, I'll turn it over to our presenter, Brian.
Thank you very much, Amber T. I certainly appreciate the opportunity to present to the School-Based Health Alliance and all of the participants tonight. I think you'll find the information that I'm going to present today will be very interesting. And for those who have not heard of National Drug Facts Week, we hope that you bring it to your communities. So once again, thank you very much, and thanks for everybody for being here and participating today. Take a look at the agenda. School-Based Health Alliance and NIDA collaboration. What is NIDA? National Drug Facts Week. I'll give an overview and what the goals and objectives are. The audience for National Drug Facts Week, outreach and promotion, partners, and next steps. And so we've been working with School-Based Health Alliance for the past couple of years with our National Drug Facts Week efforts, and they've been gracious enough to disseminate our information, our e-blasts, and we've worked together really to tailor communication messages as it relates to teens and substance abuse. NIDA, for those who do not know, we are one of the 27 institutes and centers that make up the Federal National Institutes of Health, and our charge really is to get the science that is done by the scientists, whether in-house or all around the world. We even have an international program out there to communities far and wide. So we want to make sure this information does get into your hands, because as far as substance abuse, a lot of information is out there. A lot of organizations are charging for this information, and all we ask is to utilize our information because it's real, it's about the science, it's about education, and it's really about the facts. So just wanted to bring that up as well. So National Drug Facts Week started a number of years ago, more than 5 years ago actually, with our Drug Facts Chat Day, and thought that, based on the information that we provide as far as a federal agency, we have a pretty good grasp with teens and teen influencers that we really wanted to build this out into a week-long of events and see what type of information we would be able to deliver to communities such as yours. So we achieve our mission in 2 ways. We provide strategic support and research across a broad range of disciplines, as well as to ensure the rapid and effective dissemination and use of the results of our research to improve prevention and treatment, as well as to inform policy as it relates to drug abuse and addiction. And we are the source for, trusted source for science-based drug abuse information. And that includes nicotine as well as addiction, substance abuse prevention and treatment, illicit drugs and their medical consequences, as well as prescription drugs, and the link between drug abuse and HIV/AIDS. And we do this very effectively. We work with all of our federal partners, including SAMHSA, the DEA, well as the National Institute of Justice, and a number of other federal organizations as well as state organizations and even local government. So we try to make sure that everything that we have is readily available and there for your use. Every year for the past 40 years, we've been doing this Monitoring the Future survey. And for those of you who haven't seen this survey, I encourage you to take a look at the results. It really measures the perception of drug use among 8th, 10th, and 12th graders. And we just released our survey findings from 2014. And this information is on our website. It's very, very interesting to see the different types of trends that are out there. And we're surveying about 50,000 students a year. So with that being said, we have a website that is dedicated to teens. It's our NIDA for Teens website. And what we do is we're working to get these facts out about drug abuse on the brain, body, and behavior directly into the hands of teens. And one way that we do that is through departments of education, School-Based Health Alliance, and some of these other groups that effectively reach teens. We make sure that you know, if there's a particular conference that may be related to teens or risky behavior, things like that, we make sure that all of these resources are available for the taking. And one of the things that we do is that if there's an organization that would like to have our materials, one of the things that we can do is we can co-brand them. If it's a publication or materials that were no longer in print, one of the things that we can do is hand off the print files, and these print files can be adapted for your use with your logo. So that's also another option, you know, because we know that this particular audience, being teen teachers, teen influencers, you know, everybody doesn't have access to the web. And we want to make sure that these resources are available and without discriminating against folks who don't have access to the web. So just an interesting fact here, almost 2/3, 64% of high school seniors do not view regular marijuana use as harmful. And this is compared to 35% about 20 years ago. So this is a very interesting stat, and one of the reasons it's probably like that is, you know, as marijuana becomes legalized, the perception of risk goes down, and perception of harm goes down. So this is a really interesting fact, and you know, in your particular communities, I'm sure everyone has stories about what the teens are doing and what they're not doing, as well as the risky behaviors that are taking place. And there's a lot of myths about drugs that are flying around, and these are some of the myths that we hear about day in and day out. Prescription drugs are always safe because they're prescribed by doctors. Well, we all know that's not true. Prescription drugs, you know, they're used as long as they're prescribed by physicians and they're taken in accordance with what, you know, the directive is, then they are, you know, they are relatively safe. Pot is not addictive. You know, we've done a lot of research, and research has shown that in the developing brain, which is up to about 25 years in adolescence, we have shown significant decreases in IQ scores. Drug addiction is a choice. Natural drugs are safer than synthetic ones. These are some of the alarming myths that are flying around. And so why are we here today? We are here today because National Drug Facts Week is one of the projects that I work on at NIDA. And we've seen this grow over the course of the past 5 years, reaching thousands of teens and tweens with the information, with this science deliver these messages and to make sure that we utilize our resources. You know, and this isn't just a one-way street, and it's not just about the week itself. This is about every single day and being able to call on us. You know, when National Drug Facts Week first started out 5 years ago, we had about 60 or 90 events for the week itself, utilizing our materials. And a lot of these were school-based events, and they were folks who knew about our materials, and we saw it grow pretty rapidly. And I'm happy to say that this year we're already over 1,000, and we're about 11,000 events, and we're about 11 days away. And so we're getting inundated now with all kinds of requests for NIDA materials, for NIDA information. And this is really a great opportunity for the Institute and really to show the country and even the world, because we are working around the globe with events that are in Lithuania and all over, Tanzania, you name it, it's out there, Egypt. And you know, they're looking at us as the leaders of providing this information, and you know, that's what we want. We want to be able to talk to different communities as well as highlight their communities for the events that they're doing for the week. You know, and it's not too late to get involved. You know, we're happy to provide these resources, and you know, if you, I'll go into this a little bit later, but when you take a look at what's happening all across the country, as of today, we have about 47 or 48 states, and the other two or three states have committed to participating. So we'll get those states on board and registered. But we're looking for, if there's folks that are part of the webinar from South Carolina and North and South Dakota, we don't have any, we'd like to have a stronger presence in those states. There's multiple events in many of the other states, but shortcoming in North and South Dakota as well as South Carolina. And like I said, they will be registered because of, you know, not only because of our outreach, but because of the outreach that other groups that we are collaborating with are promoting. So we're happy to take on more events and to provide as much information as we can. And in return, one of the things that we're doing is highlighting the event holders on our website. And so that's really an interesting piece that we'll go into a little bit later. So National Drug Facts Week, you know, we're working with schools and community groups, prevention coalitions, municipal governments, and like I said, all of our federal partners to provide this information. One of the things that we have developed over the course of the past few years, knowing the demand, is to create an interactive website called PeerX, and it's part of our NIDA for Teens initiative. It's an interactive site that's really a great opportunity to provide supplemental information for our partners, for schools, things like that, really ways to engage with teens. We work with teens with our teen advisory group. We have teens all across the country that participate and help us with these materials, what will resonate with their particular communities. And you know, this is something that's very important, not just to throw information out there, but really to work with communities and work with teams to make the information valuable for them. So as you can see, some of our NDFW 2015 partners are listed on this page, and you know, they are some of them are very different. They all do work with teams. They are very different. in many respects, from health officials to even 4-H and their extension service, and recovery, treatment organizations, prevention, and school-based organizations as well. So, like I mentioned, getting involved in Drug Facts Week is easy. Putting on community events for teens, creating web and social media activities. All of this information is readily available, and it doesn't cost anything. These materials are free, and they can be ordered on our website. We don't charge anything for shipping, nothing as far as our materials go. We've created and fine-tuned over the years also a toolkit that is online. It's an online toolkit, and this toolkit provides it's 6 easy steps to hosting an NDSWO day, and it's on the site there that you see on your screen, and this can be utilized for your event. Your event doesn't have to be large. It can be small. We've had governmental proclamations. We have social media. We have schools that are prevention organizations that are providing signs and video clips and all kinds of some great resources. This is what our intention is to provide these myriad materials and to show that they're being utilized. So when you take the information back to your communities and you're having events for the week, we want to be able to see that you're using the materials or you're creating some type of artistic event, maybe around shattering the myths, poster contest. All of these different things are part of the online toolkit. So we're excited that we've had some rave reviews from a number of event organizers that they're using this toolkit really as an example when they're creating toolkits of their own for specific campaigns or for resources. So it's really user-friendly, and encourage you to take a look at your community. Like I mentioned, some of the showcase materials that we have is our Drug Facts Shatter the Myth booklet. This is a very popular piece and can be ordered through through the website. It's not text heavy. It has real nice graphics and really a nice supplemental piece for whatever activities you do. Our science of addiction is sort of goes through the basics of science of addiction, how drugs affect the brain, body, and behavior. And really is a tremendous booklet that we have updated over the past few years. Another thing which is great is our National Drug IQ Challenge, which is also available in Spanish. This particular IQ challenge can be taken online, and every year it changes. We have new questions, and the answers are provided. This is really a good way to gauge what the students or teens know about drugs. So definitely take a look at that on the site. Another great piece that we have is our Drugs in Your Body poster that we worked with Scholastic on. Scholastic, we've had a relationship with them for a number of years, and we create materials yearly, and this Drugs in Your Body really is a great piece because it includes a teaching guide. And online, if you look at the online piece, it'll go through each of the organs. You take a look, like for instance, you can see the fishing hook and things like that. If you were to take your cursor and put it over that, it'll sort of give you a highlight and a description of what what drugs actually do to your brain, or what meth does to your teeth. things like that, or what alcohol does. These are all different things, and even the we go into steroid abuse and things like that, because we know that affects the teen population as well. So these are all great resources that can be ordered, and even if you're not holding drug facts with events, we certainly encourage you to take a look at these pieces, and you'll find them extremely valuable. So I think preventing drug abuse is possible, and like I tell everyone that I talk to on the phone and engage with through email, is that these efforts cannot, we wouldn't be able to sustain these efforts unless we have organizations that really take this information and run with it. And being able to grow and build on our efforts and to partner with different types of organizations is a critical piece. We could not do this without you. So certainly appreciate your efforts. In return, we are at your service as a federal agency. Taxpayer dollars are paying for this, and if you have questions or you have concerns or you want to participate in Drug Facts Week, even if you may think that it's too late, it's not too late. Believe me, we get registrations up until the last, up until even the middle of the week. Take a look at it. If you send an email to drugfacts@nida.nih.gov, it will be me who gets back to you, and I will make sure that I provide you with whatever information you need, whatever resources you need, and be as receptive as possible to your needs and your community. So I encourage you, please send me an email. I will get back to you and make sure that you have whatever you need for your communities. So with that being said, I'm more than happy to answer any questions via the chat, or anything that comes about. Like I said, I certainly appreciate the opportunity to be with you this afternoon. I know sometimes it can be hectic taking time out of your day to participate, but really I wanted to thank you again, and I hope that you do register for Drug Facts Week and we'll get you up on our site and create a collaboration for this day forward. So thank you very much again.
Thank you so much, Brian, for the great information, and we're all looking forward to National Drug Facts Week. We will take questions, but first let's launch this last poll. Do you plan to participate in the National Drug Facts Week in January to February 2015? All right, 5 more seconds. Okay, great. Thank you. And at this point, we'll take all questions from attendees. All right, we're going to give you a couple more minutes to think of your questions. If you do have a question, please type in the chat box. All right, great. Our first question is, what were some successful activities in the past on drug facts tailored to high schoolers that you can think of?
So there was a lot of, we had a lot of great events for high schools, actually. We've had pharmacists that had come. There was a big prescription drug problem out in Colorado, in Golden, Colorado, a number of years ago. And 3 of the different schools that were in that particular community had events, and it was based around prescription drug abuse. There was a pharmacist that participated. There was a number of health officials that came from public health departments that were able to participate. It really got the whole sort of the whole community involved by working with the local authorities. So interestingly enough, all states have drug and alcohol abuse directors, and even beyond that, it goes to the local community. There's always resources that are available, and a lot of schools, what they do is they tap into these programs. A lot of schools also have efforts for students that are part of their leadership, and they get credit for utilizing this information. And I can't tell you how many events that that students have participated in really making events great by engaging with the students and using that as their for service credit.
All right, and we have another question. Can activities be planned for middle and elementary school kids, or is this only for high school?
No, actually, we have National Drug Facts Week really is open to anyone who wants to participate. We have materials that go all the way down as far as kindergarten, and obviously the messages for elementary school are different than they are high school. We have materials that are called Brain Power, and they're on our website, and you can you can take a look at those materials for that particular audience, and they can be used, and we actually encourage you to utilize these materials. It's K1, 2, 3, 4, 5, 6, 9, and we do call it Brain Power materials. So take a look at those. Take a look at those materials, and you can have events. We do have several events that are actually at elementary school for this Drug Facts Week.
All right, another question. Do you have any lessons or materials relating to drug use and consent?
Drug use and consent. We don't necessarily have materials for drug use and consent. Maybe if that can be elaborated on a little bit more, I may be able to provide a resource for that.
Yeah, so this person actually briefly said they teach individual lessons on sexual health topics, and okay. That's right.
So
that's,
I'm sorry.
No, go ahead, Brian.
Okay. Yeah, I mean, as far as consent goes, that's not really our domain. Our domain really is providing the research that's being done. One of the things that the person who asked that question may want to do is take a look at the U.S. Department of Health and Human Services, their Administration for Children and Families. Administration for Children and Families, they're one of the divisions within the U.S. Department of Health and Human Services, and they may have some consent materials that they could offer up. We don't.
Thanks, Brian. I'm going to give you another touchy and tough question, but it's very important when dealing with adolescents. How do you respond to statements surrounding the legalization of marijuana in some states? For example, if pot is now legal in some places, just like alcohol, why do you say it is still not okay?
I couldn't hear you. One second. Can you ask me just the second part again? I'm sorry.
Sure. I'll repeat the entire thing.
Okay.
How do you respond to statements surrounding the legalization of marijuana in some states? For example, if pot is now legal in some places, just like alcohol, why do you say it's still not okay?
So the interesting thing is with that's actually a policy issue, and that can be responded to by the White House Office of National Drug Control Policy. Interestingly enough, with the marijuana laws are created by the states for legalization, and you know, we still do research using marijuana as a, you know, for medicinal purposes. And as far as the actual, you know, as far as your actual question about, you know, how can we say, you said how can we say that it's okay to use? Was that the last part?
Yes, it states, if pot is now legal in some places, just like alcohol, why do you say it's still not okay? That's a teenager asking him.
Yeah, no, that's fine. You know, first of all, we do research with marijuana, and we know that with the developing brain, there are effects, and we've seen decline on, like I mentioned earlier, IQ scores and things like that. So with the developing brain, you know, we obviously take all these factors very seriously, and we don't want to mislead or misguide anyone as far as whether or not marijuana or the chemicals that go along with it, you know, are harmful. So, and so we want to make sure that this information is, you know, is available. And we have a lot of information on our site from the science that's done about marijuana and policy issues, which that question definitely is a policy issue.
Thanks, Brian. So hypothetically speaking, if you have a teenager that comes to you with challenging questions about drug use, do you have resources for professionals to adequately respond to those individuals to ensure that they do not use drugs or consider lessening their drug use if they've already begun? We
have scientists. Most of our staff at the Institute are scientists, and as far as resources for individuals that are, you know, are looking for help, you know, different types of resources for their addiction, we have on our website treatment information that's provided by SAMHSA, the Substance Abuse and Mental Health Services Administration, that lists treatment providers, things like that. There are a lot of great resources on our website for you know, that center around treatment. But SAMHSA has a lot of great information as well with their prevention and treatment office.
That's wonderful. Thank you, Brian. We've got a couple of questions about archiving the webinars, and yes, all of our webinars are archived, and within about 2 to 3 business days of after the webinar. If you have any more questions, please continue to type it in the chat box, but we're going to move on with our webinars. So just a few reminders. Here to save the dates and join us as we celebrate 20 years of collective impact for student success. Our annual convention is June 16th through the 19th of this year, 2015, and will be held in Austin, Texas. School-Based Health Alliance is a membership organization. We rely on members to support our work as the national voice of school-based health care. If you are not currently a member of School-Based Health Alliance, we hope you're considering joining. We offer two options for memberships: individual memberships and organizational memberships. To learn more about membership benefits or to become a member, visit the Engage section of our website at www.sbhforall.org. Once again, thank you so much to our presenter, Brian Marquis, for such a great presentation. I hope you all will engage your communities and SBHCs to promote the use of NIDA science to shatter all the myths about drugs. This presentation has been recorded and will be archived on the School-Based Health Alliance website within the next 3 business days. To request support and technical assistance related to drug use prevention, please send us an email at programs@sbhforall.org. Take a moment to fill out 3 poll questions that will appear on your screen. We will also be sending out a brief evaluation survey within the next 2 days. Please let us know how we're doing. Your feedback is vital in helping us craft presentation and tools that will best serve you. And lastly, thank you for joining us today. All right, did this presentation meet your needs? We'll give you about 20 seconds. About 5 seconds. Did this presentation provide you with usable ideas and or techniques? 20 seconds. About 5 more seconds. And lastly, would you recommend this webinar series to others? 20 seconds. Five more seconds. All right, guys. Thank you so much for joining us today, and thank you again, Brian. That was a wonderful presentation. I hope everyone has a great afternoon.
Thank you.